Number 12, Trip Master.
Trip Master. What? Who's the jockey?
Karpen Pillay is going blind. His eyes have grown cataracts, bringing with them a creeping darkness and a terrible despair.
Can't even read the name of the horse. I felt like I lost my hope. I lost hope in everything. I thought I just lost my life. That's what I thought.
But tomorrow there'll be every reason to live, thanks to a remarkable cure. This is Umphumulo District Hospital in KwaZulu-Natal. It's one of the few rural hospitals with a fully equipped eye clinic. In a country where thousands are losing their sight due to cataracts, a simple operation is all that it takes for the blind to be able to see.
Manje semphatheka manje manje sengingena kuleliso ngapha manje
besengene ngikakhulu ngoba bengike ngithi mangithi ngiyahamba mhlambe indawo kube sangazathi iphakeme mina mangithi ngiyabuka kanti ayiphakeme kwesinye isikhathi bengithi mangithi ngiyakhuphuka emastepesini kuvele kube mnyama emehlweni ngivele ngiwe.
If you lose eyes, hey, I don't think it's worth living. That's what I think. Truth, God, in my life, I'll take my gun and shoot myself. This will be an oath.
Cataracts are a condition where the lens inside one or both eyes grows gradually cloudy. As it progresses, vision becomes dimmer and more blurred until it becomes impossible to see anything at all. Unlike other eye diseases, it can be easily operated and cured, but few public hospitals have the staff or capacity to cope. So private medical providers have joined government efforts by bringing cataract surgery to remote rural areas.
There have been a range of partners who've gotten involved to enable the cataract surgery to take place. So I think just underpinning what we do, it's really about giving people access to health care. It shouldn't be the preserve of those who can afford private medical aid. And secondly, to strengthen the public healthcare system. And we do this in a range of ways. We've enabled doctors to be trained, and we've made an investment into the delivery of a service.
Cataracts affect nearly 1 million people, and 80% live in rural areas where its effects can be devastating.
Phela kunzima ngoba ekhaya anginaye ubaba wabantwana angilokhuza baba abantwana bashonile bobabili khona kulonyaka ndodlule kwasentombazane yodwa noma khoti ke lo ngiphelekezelayo ifisa sengathi kungamkhanyela njengoba namhlanje khona indlela emthathini wasithi nikeza wena.
Cataracts are the leading cause of blindness in South Africa. In some cases, it's the result of poor diet, alcohol abuse, and diabetes. But it's most common in the elderly, affecting 2 out of every 3 people by the age of 65.
They lose the whole identity, for himself or for herself. It's like if I ask them, they told me as they are living in a dark, they're just living in the forest where everything is dark. They can't see nothing. Even their hands, they can't see it. Nothing. nothing.
With a desperate lack of specialized eye nurses in rural areas to screen and diagnose cataract patients, many are unaware or suspicious of the treatment that's available.
Some they're having a lack of knowledge where they don't know what to do. They're living with blindness years and years. And I go there and tell them about the cataract and how to treat cataract. And some is very much difficult to convince them because some they are having their own beliefs, which gives me a very big problem to convince them. And some they told me that, oh, even my father was dying like this, so I'm not going to do that thing that they were telling me.
Although cataract surgery is a national priority, public hospitals are chronically short of qualified staff, so a team of specialists from the United States and India are training local doctors to perform the operation.
We lack the eye care personnel to appropriately screen, counsel and refer people. Many of the primary healthcare nurses are doing their best, but often we need more people to support that. Most of these rural outlying hospitals don't have the surgical facilities or the ophthalmologists to be providing the service. The number of ophthalmologists in our public sector is too little to have that kind of outreach that we need within the public sector. Even if you start services in certain hospitals, if the budgets run low, then consumables becomes a challenge.
The cataract is removed under a local anesthetic and replaced with a clear artificial lens. It takes less than 30 minutes before the procedure is complete.
Once they come to our table, operation table, we make some painting and wrapping that to make this area to be sterile. And then we start the surgical steps. In surgical steps, we put incision, and that incision is very say 2.8 to 3 millimeter size. So it is very minimum size of incision. We remove that cataract lens, and after removing that, we put the artificial lens. And the beauty of surgery, from the second day, the patient can do his normal work from very second day.
Cataract removal is one of the most cost-effective and successful healthcare interventions in the world, but around 350,000 South Africans in need of the surgery are stuck on a waiting list.
We have such a big backlog, and unless we get rid of the backlog, we're always going to be swimming against the tide. This is a beatable problem. We can win this battle. There are many conditions that are chronic, they go on and on. Your management has to be there for many, many years. You've got to constantly give people drugs. Cataracts, you do a surgery, after 2 hours, the patient is ready, you've addressed the problem. And I think it's something that it'll be good for our healthcare system in South Africa to have a significant victory. And if there's anything that we can eventually gain a victory through, is the management of cataracts in the public sector.
The dawn of a new day and the promise of a new life. For John Umphumulo, it's been a 3-year struggle to regain his sight.
ngabona isikhathi sengibuyile lapha ekhaya hayi ngabona manje angisaboni kahle manje emahlweni ngisaboni ngathi ngisebenza impela konke bebhalito ngisebenza ebhalito ngakha izindlu zabelungu ama flat also Sheffield the post station imina ngiyakha futhi esandla zami lesi ngumuntu omnyama uNkulunkulu ungiphile nisinkwa ngustart 2 esikolweni angifundanga kakhulu kodwa ingqondo ikhona ngathi nginalo impela ithemba hayi ukuthi ade nganali abaningi abantu abazi into leyo bazi ukuthi hayi lapha esibhedlela ngeke usabona ngani manje uzoqhumukisa wabheka nje yaqhumiso lakho.
Being poor and blind in a rural area makes treatment difficult. Hospitals are few and far between, and the cost of transport higher than most can afford. So eye care is often low on people's list of priorities.
There's a belief that this is part of aging and we should accept it. And I would argue that we accept wrinkles, but we don't have to accept cataracts as part of aging, because there's an easy, affordable surgery that's available, and in most cases you don't even have to spend a night in a hospital.
It's the moment they've all been waiting for. Now they'll find out whether their surgery worked. Removing their eye patches brings startling results.
Right, sengiyabona.
Ngijabula kakhulu manje ngibuka kahle yonke into manje. uNkulunkulu anibusise. Awu ngikhululeke kakhulu. Kakhulu kabi.
The procedure has few complications, and 90% of patients will have their vision fully restored.
Are you happy, Mama?
Yeah.
Awu ngathi ngizelwe kabusha.
But swamped by other pressing demands, rural hospitals are seldom able to offer their patients even basic eye care, let alone surgery. So in many communities, people with cataracts never get treated at all.
Ngiyabonga Nkosi, ngiyabonga. Hawo. Sengiyakwazi ukuba ngisho udokotela emehlweni mangasaboni lutho. Yey. Hope ngiyababona manje bonke abantu ngiyababona bonke.
The operation costs less than 2,000 rand and can change a person's life forever.
Lengithi ngeke ngisabona. Dala. Dala kakhulu.
It's fantastic, I'm telling you. And you're looking so beautiful. Thank you very much, Doc. I can see very, very bright now.
My son was on the night.
Not true. I pray.
That's why it's clear. Thank you. Good. Hey, with the paper I can't see yesterday, but now I can see clear, man. Hey, my God. Really, Uncle?
Helping take pressure off the overburdened health system are outreach programs like this one. They'll treat an extra 4,000 patients over a 2-year period and also give staff skills and experience to keep the eye units running.
It's not a once-off investment that we've made, that what exists here now can continue, that people can access this facility because you've got medical personnel who are specialized in a particular type of treatment, and there's a huge understanding of what is required going forward. So I think that it's a sustainable project, and I think we want to ensure that people will always be able to access a facility of the kind like this one here.
For the patients at Umphumulo, the program has brought a future full of possibility.
ngathi ngiphuma kwenye nje indawo engingayazi ngathi sengibuyele kwelinye izwe nje namhlanje sengijabule kakhulu ngabe sengikhululekile.
Within hours of having her dressing removed, Thandi Umphumulo is back home.
Uyangibona mina ngiyakubona ngempela into ephinki idukul phinki iskipa sphinki imbali la amaflower sengibona njengoba ngiwabona vema ngiyabonga wema awukwahleke ngibona step la ngeke nje sangiwisa ngeke sakuwisa woza ke ngibona ngithi yakhumbula ngithi le step isayangwisa ngoba ngiboni woza ha awubheki nje siyabonga unjani gogo usefikile makoti. Ngiluza impilo yami yonke ngoba phela ayikho into engabuya ngiyenze uma amehlo ngingenawo. Into ebalekile ukuthi amehlo ube yiwona akwazi ukubona ukuze ngikwazi ukwenza yonke into ngoba ngaphandle kwamehlo ayikho into ongayenza. Futhi mangiluza amehlo phela ngiluza impilo yami yonke ngoba impilo isemehlweni. Sishaye lo moya la endlini.
As is so often in rural areas, her husband is away working in Durban, so she'd be left to run the house and look after the family alone. With no help at all, not even services like water or electricity, her blindness made an already heavy workload even more difficult to cope with.
Ngoba bengikuthanda ukusizakala ukuthi amehlo avuleke. Nakho kasevulekile futhi. Ungasabi kwami kungisizile mina. Ngoba amehlo avulekile ukuba ngisabile ngabe namanje ngisahamba ngiphumputha kodwa ngoba ngikwazile ukuhamba amehlo avulekile.
The freedom to move without fear of falling over is such a huge breakthrough that the first thing she does is head off to her fields.
Ya bekunzima kakhulu ukusebenza ensimini nokuhlakula obhontshisi kanjena. Ngoba kuqala kade ngithi ngisashaya uvela ugenxa kubhontshisi ngingawuboni ngizizwa ngijabule kakhulu ngijabulele konke ngikubonile bengikushiyela ekhaya imbuzi zami sengiyibonile izinkukhu namasemami kade sengiyoshaya ngahlakuhlakula nobhontshisi wami njalo sengijabulile inhliziyo yami ithe
For the first time in 4 years, Albert Mthwetwa can see his children and grandchildren. It has given him a new lease on life and is cause for much celebration.
Bumnandi. Awu bumnandi. Nelanga libalele bumnandi. Okay. Beke phansi ke. Kodwa phansi. Ophinda. Bumnandi. Singamnika omunye umuntu. Santo. Bumnandi. Shaya bazukulu. Ebezinzima izinto bengakwazi ukukhipha inkomo izingane sesikoleni ngihlupheka inkomo ivele ngishiye ngelikulu ijubane ibaleke ngoba ongathi yazi ukuthi angisabone emehlweni.
It's not just the blind who suffer. The loss of income can send whole families spiraling into a downward cycle of poverty and despair.
Cataracts constitutes 50% of avoidable blindness. And there's enough studies that have been shown that close to about $250 billion of lost productivity occurs as a result of blindness. And we can tackle 50% of this problem. Many of the elderly have now become the sole breadwinners of their family, or at least they are the people that have to manage the family. And a lot of this is happening in some of our rural areas. It's important that they have the vision to be able to function. It's also about quality of life. I mean, many of the people who are affected by cataracts, because it's an age-related condition, are people who have worked all their lives and have struggled all their lives to educate and support the younger generation. And at the time of their life when they should be relaxing and enjoying themselves, they are now confronted with this blindness.
For Albert Mthwetwa, being forced to depend on other people was the worst part of losing his sight. He'd felt robbed of his purpose and also his dignity.
Bona yonke into nokucenta egcekeni ngibona ukuthi akungcolile la ngithatha igeja ngicenta egcekeni mase ngikhathele ngibuye ngihlale kancane ngiphumule.
Curing blindness is more than treating a handicap. It's a release from years of inactivity and confinement.
Bengihlupheka kakhulu kabi. Ngithi ngiyafuna ukuzenzela ngithume umuntu kanti naye ayazi ukuthi ngiyibekephi ngihlupheke ngize ngimkhombise ukuthi hawu ngiyibeke lapha ngingasaboni sele ngibamba amehlo.
Loss of vision is one of the most challenging hardships that a person can live through.
Kodwa ngiyabonga namhlanje lapha kamaphumulo ngingisize kakhulu inhliziyo yami ngabe ngiyahamba emhlabeni kodwa inkosi.
John Mdleche was building his family home when he went blind. It put an end to his plans as well as the construction.
Ngajabula impela kakhulu bebethi embuza umama hawu usakaza ukubona ukuthi hayi singiyazi sembuka phezulu ngivaleni iliso hawu ngibona semboya irufu oh ime kanje straight manje ngaze tafana njengokuqala manje ngabona ngingisize kakhulu ngiyabona hayi umsebenzi ngisazowenza ngibona manje ngiyawuthanda umsebenzi angihlali phansi mina umuntu osebenzayo too much.
Leaving the house incomplete had been a source of pain and frustration, so within a day of his surgery he's already started work to add on a room.
Ngijabule kakhulu ngibona sengibuka kahle manje ngingathi ngiyaqala ngifike emhlabeni namhlanje.